What's up, viewers? You've heard the term cold feet before, right? It's usually used as an expression for when someone gets too nervous and backs out of something. Well, there's a little more to it than that. Cold hands and feet are a real thing we all get sometimes. Just depends on the temperature of the room you're in. But are you getting cold hands and feet more frequently? That might be a sign of a more pressing health problem. Let's talk about those health problems today. Do you have anemia? Are your arteries not as healthy as they should be? What exactly is Raynaud's disease? We're talking about all this and more. Just like an air conditioner senses the temperature and adjusts the airflow accordingly, your body is designed to control your temperature. It's almost as if it's a machine itself. During the summer, it was using a physical phenomenon called evaporative cooling. This cools you down. The sweat on your skin absorbs the heat when it evaporates, but in that process, it loses fluid and your body tells you to get some water. But you're attracted to more cold drinks and cold water. That's because the cold water reduces your temperature and prevents overheating. When it's cold outside, your body makes sure to keep the blood flowing to your core and vital organs in order to keep them warm and working properly. This changes the blood flow to your hands and feet, making them feel cold. This is normal. The blood vessels in your hands and feet become narrow when it's cold in order to prevent heat loss from your core. Some people have colder feet and hands naturally. There's no underlying disease with them. It's a fairly common condition. When your hands and feet naturally get cold, you just need to take extra precautions in cold weather. Some people work in very cold environments. Meat packers, military personnel, mountain climbers, hunters, and rescue workers are some of the people who need special protective clothing to keep themselves warm. Being in a very cold environment carries the danger of frostbite and permanent damage to hands and feet. These people develop a tolerance for the cold. Fishermen can work with their bare hands in extremely cold weather. Women are at higher risk of cold injury because their hands and feet cool faster. If your feet and hands have been too cold lately, or you notice additional symptoms such as color changes in your fingers, there are a few things you can do. So many things can make your hands and feet cold. Your own body has a baseline and a natural response to cold temperatures. The most common conditions that can cause coldness in your limbs are related to poor blood circulation or nerve damage in your hands or feet. Anemia is a condition where you have fewer healthy red blood cells than normal. It's usually caused by an iron deficiency. When you have an iron deficiency, your red blood cells may not have enough hemoglobin to transport oxygen from your lungs to the rest of your body. The result can be cold fingers and toes. Several women worldwide suffer from anemia. This might be a reason why so many get cold hands and feet. A blood test can determine if your blood has less iron than what it needs. Eating more iron-rich food and taking iron supplements can help relieve your cold hands and feet. Several types of arterial disease can also cause cold limbs. Your arteries are crucial for your body's functioning. When they're not working properly, they reduce blood flow to your legs and feet. Peripheral artery disease, or PAD, affects about a third of people over 50 years old with diabetes. PAD typically causes arterial wall damage in the lower extremities when a buildup of plaque on the walls of the blood vessels causes them to narrow. PAD symptoms, in addition to cold feet, include pain, numbness, and sores in your lower body. Primary pulmonary hypertension is a condition that develops due to high blood pressure, which damages the arteries of the lungs, often involving numbness in your limbs. It comes along with difficulty breathing, fatigue, and dizziness. If you have any of these symptoms, along with cold hands and feet, make sure you see a doctor. Treating the arterial disease early can lead to better results. Another reason for cold feet and hands could be diabetes. Poor blood circulation is a symptom of diabetes, which can make the temperature of your feet and hands drop. Diabetes also increases your risk of heart disease and narrowing of the arteries due to cholesterol and plaque buildup. Both of these can contribute to cold hands and feet. The fun just never stops when you have diabetes. On top of all that, the disease can also cause nerve damage, especially in your feet. It's caused by high blood sugar levels over a long period. One of the early symptoms is a feeling of pins and needles in your feet or hands. It's important to keep your blood sugar levels steady and as close to normal as possible. Also, if you have nerve damage, check your feet carefully for wounds you might not feel. These wounds could become infected over time. If it turns out you do have wounds, try talking to a doctor ASAP. They'll usually prescribe you whatever you need. Thyroid hormones work to keep your body's metabolic functions running properly. When your body doesn't produce enough, the condition is called hypothyroidism. It affects more women than men and is more common over the age of 60. When you have hyperthyroidism, you're gonna feel cold more often than usual. You should also look for other symptoms like fatigue, joint pain, stiffness, dry skin, and thinning hair. On top of that, a person suffering with hypothyroidism is more likely to feel depressed. A doctor can determine whether or not you have hyperthyroidism by doing a blood test. The main treatment is a synthetic hormone supplement, which is meant to be taken daily. Let's move on to Raynaud's syndrome, also known as Raynaud's disease or Raynaud's phenomenon. This is a condition that makes your fingers and sometimes other parts of your body feel cold or numb. It happens due to the narrowing of arteries in your hands or feet. Raynaud's may change the color of your fingers. Pretty scary, huh? When your blood circulation becomes normal, your hands may tingle, throb, or swell. Raynaud's is triggered by cold temperatures or stress. Other medical conditions can also cause Raynaud's. This kind of condition is called secondary Raynaud's. For most people, it goes away on its own, but in severe cases, you do need to visit a doctor. Scleroderma, an autoimmune disease that causes hardening of the skin, is often accompanied by Raynaud's. Other autoimmune diseases that bring on Raynaud's include lupus. Carpal tunnel syndrome, which causes numbness and weakness in your hands, often causes your hands to become cold along with pain in the forearm, shoulder, and neck. This happens due to pinching of the blood vessels, causing restricted blood flow. Mostly, carpal tunnel syndrome is caused by the inflammation brought on from infections. A vitamin B12 deficiency can give you neurological symptoms, including the feeling of cold hands and feet, numbness, or tingling. Vitamin B12 is found naturally in meat and dairy products and is important for maintaining healthy red blood cells. Your body doesn't make it, so you need to get it from the foods you eat. The deficiency can also cause fatigue, problems with balance, anemia, pale skin, shortness of breath, mouth sores, and cognitive difficulties. A blood test can indicate vitamin B12 deficiency. Treatments include taking an oral supplement, receiving vitamin B12 injections, or changing your diet. Apart from giving you lung cancer, smoking injures blood vessels throughout the body, which then become narrowed and contribute to cold fingers and toes. Over time, smoking can damage the blood vessels in your heart, making it harder to pump blood. This again will affect your legs and feet. Get help to quit smoking. There are trained professionals, therapies, and even apps that can help monitor your progress. Other factors that may lead to cold hands and feet include your age, family history, and medications you're taking. If you have a bacterial or viral infection, as well as a fever, you may also feel chills. Sometimes anxiety can even give you cold hands and feet. And as if that's not weird enough, a 2016 study shows a strong connection between chronic indigestion and cold hands and feet. A 2018 study looked at the relationship between chronic conditions and your limbs getting colder. It showed that cold hands and feet were directly linked to high blood pressure in particular. Babies and older adults have additional risk factors for cold hands and feet. Babies lose body heat quicker in the cold because they have a larger body surface area compared to their weight. They don't have enough fat under the skin to use as insulation. Also, their natural body temperature is not fully developed. Older people lose the ability to control their body temperature as years go by. The blood vessels in their extremities don't constrict as easily to keep their core warm. Their metabolism also plays a part in this, as it tends to slow down with age. The clothes you wear also make a huge difference. If you're suffering from cold hands and feet and it's getting colder outside, you're going to want to wear warmer clothing. I'm talking about a hat, gloves, warm socks, and a warm coat. Wear layers to keep your core warm. Tight clothing does not fit in a colder climate and will only make matters worse. Some people find a scarf or turtleneck helpful as well. There's nothing worse than a certain part of your body being uncomfortable. Cold hands and feet are just one example. It can get much worse. Let's keep the conversation going with a couple more videos, shall we? Check out 8 signs your body gives you before a heart attack. Or how about looking at 10 body changes that need your immediate attention? Go ahead, click one. Or better yet, watch both and learn more about these telltale signs that your health is declining. Have you been experiencing cold hands and feet? Let us know in the comments below.